Welcome to this overview on the vital clinical tools, brain death assessment, and the Glasgow Coma Scale, or GCS. Understanding these is crucial in critical care. First, let's establish the terminology of consciousness, defining the spectrum of awareness we deal with in patient assessment. Consciousness is being aware and responsive. States like sleep are temporary unconsciousness, while a coma is a deep state where the person cannot be awakened. Stupor is minimally responsive, and locked-in state is paralysis without loss of consciousness. Next, we focus on brain death, a solemn diagnosis requiring strict criteria. It represents the irreversible loss of all brain function. Brain death is defined as the irreversible loss of both the capacity for consciousness and the capacity to breathe, signifying total permanent brain loss. Before diagnosing brain death, we must rule out reversible causes like drug effects, severe hypothermia, or serious metabolic issues. Brain damage must be known and irreversible. Confirmation of brain death relies on two key sets of tests, starting with verifying the absence of all brainstem reflexes. These tests check for zero pupil response to light, no corneal reflex, no gag or cough reflex, and no eye movement with the cold water ear test, known as the vestibulo-ocular reflex. The final critical confirmation is the apnea test, which assesses the capacity to breathe independently. The apnea test involves disconnecting the ventilator for up to 10 minutes. Brain death is confirmed if the patient makes no breathing effort while their carbon dioxide levels rise significantly. Now, let's introduce the Glasgow Coma Scale, or GCS, the standard tool for measuring a person's level of consciousness after a brain injury. The GCS standardizes measurement across three components: eye-opening, verbal response, and motor response, providing an objective score. The first component is eye-opening, with a maximum score of 4. A score of 4 means spontaneous opening, 3 means eyes open to sound, 2 to pressure only, and 1 means no response. The second component is verbal response, scored up to 5 points. A score of 5 is oriented conversation, 4 is confused, 3 is inappropriate words, 2 is incomprehensible sounds, and 1 is no response at all. The third and highest scoring component is motor response, with a maximum of 6 points. Scores range from 6 for obeying commands, 5 for localizing pain, down to 3 for abnormal flexion, and 2 for extension posturing. All three scores are summed to calculate the total GCS score, which quickly indicates the severity of the neurological insult. The maximum GCS score is 15, indicating full consciousness, and the minimum is 3, signifying a deep coma or death. The total score is a vital indicator in patient care.